do you think, I know you don't have a crystal ball,
Yeah.
but do you think that the booster is going to be something that we'll need to have every year?
So it's unknown at this time. But if one looks at the waning effect over time, there's also new variants that are coming out that may not be, may get some more breakthrough infections. We know that vaccines are not 100% effective, but they certainly have a significant impact on reducing morbidity. And so while it's unknown at this time, it's likely that boosters will continue to be a factor with the COVID vaccines. But time is going to tell when we see in the next few months, I'd say, because we're going to be coming up to 2 years now, and we'll have assessment of where we stand at that point. But like the influenza vaccines, for example, they change because the influenza virus is a very rapidly changing virus. And so every year there's a new vaccine out for that. We don't know how very different the variants are on COVID-19. We know that there is certainly has been some efficacy of the current vaccines against the two major variants we have. There's probably variants that are changing all the time, but they may not be causing as significant disease, even though there are variants there. They may not be as transmissible. So unknown at this time, but I would say it's likely that that's something that we will have to face in the future.
Is there anything else that you wish people would know, or questions that people come in and ask you related to boosters or vaccines that you think people should know?
Well, I think it's important for people to know that having a booster is not going to be anything different from having the primary series. I think it's important to have the booster dose, even if you feel that you have a strong immune system, because it really is protective not only for yourself, but also to the people that you work with and the people that you live with. So that's the key message on that.
That's wonderful. Thank you so much for joining us today. We really at Elder Options appreciate you. We have come to you with many, many questions. Dr. Grainger-Rousseau has provided in-office vaccinations for us, and we are so thankful that he is here to be a community advocate and to really be a source of great information. You can always reach Elder Options at 1-800-262-2243 or email us at vaccine@agingresources.org. We are more than happy to find your local vaccine or booster location and see if we can provide a ride for you to get either the vaccine or the booster, or answer any questions you or any family members may have. Thank you for listening today and joining us with Dr. Grainger-Rousseau again. And we look forward to seeing you soon at our next COVID conversation. Have a good one. Bye.
Thank you. Bye-bye.